There we go. So now we are going to be recording. Okay, so we are recording. Let me introduce myself. My name is Sherry Kransky-Self, and I am the director for the Student Center for Research, Creativity, and Scholarship here at UL. And also, my office is the one that implements the ADVANCE program. And ADVANCE's goal is to promote undergraduate research here at the university. And we do this by promoting all kinds of things and getting involved with all kinds of activities. And a whole lot of those activities are with CGI, who is a wonderful partner with us as we're trying to help our students get into the workforce in a variety of ways, whether it be with technology, biotechnology, biofarm, health field. We are, if there's a student here, we want them making database decisions and participating in research. So that's how I come to being involved with today, other than the fact that I'm a woman, and I think it's important for us as women to be aware of our health. And so I'm really excited today to be able to have this panel. And what I want to do before I introduce the panel is to introduce my colleague and my partner in all kinds of mischief, Jacqueline Craddock, who is the director for the Get Pinked initiative at CGI, and she's going to tell you a little bit more about what's going on with that.
Yeah, thank you, Sherry. Hi, good evening. I'm Jacqueline with CGI. CGI, just very briefly, CGI is a global business consulting company. And we are partnered here in the state of Louisiana, celebrating our 10th year for economic impact here. We have about 800 CGI partners here delivering end-to-end managed services. In that capacity, CGI is celebrating October as our Gets Pinked across all of CGI. And we're here in person today to celebrate and do our activity with regard to that. So a little bit about the panel today will be themed around life-saving work and innovations in the fight against breast cancer. We'll be exploring topics about early detection, some cutting-edge treatments, and the importance of advocacy and education in healthcare. So thank you very much for your attendance today. And it's nice to be in this partnership, Sherry. Oh, yes, thank you, Sherry. And I did want to share with you that we have these CGI Gets Pinked postcards across all of CGI globally. We have these lovely postcards. They're here in the back if you want to pick one up. What we're asking you to do is write a caring message of support on the back. There are a couple of examples back here, so just a couple of sentences. You can leave it on the table, you can drop it in the bucket. We then will take the postcards and share them with our nonprofit and support for breast cancer awareness. They then will put them in care packages for persons who are then in their fight against breast cancer. So please do write a caring message, and we'd love to collect that today. Thank you, Sherry.
You're welcome. Okay, guys, so I'm going to introduce our panel. Our group's a little smaller than we thought it would be, so I think that has some, real pluses in that. This has an opportunity to be a real conversation with some wonderful women who do some wonderful work for breast cancer, and it's my privilege to be able to introduce these ladies, and I need to look at this paper so I get it right. All right. So I'm going to introduce first Dr. Chandra Grisby from the she's a breast surgical oncologist from Ochsner Health. And this is Dr. Chandra Grisby. Also, we have with us Sherry Hernandez from the Miles Perret Cancer Services. She's our community liaison. So Sherry. And then our facilitator tonight, who is going to be asking questions and keeping us rolling, is our very own, and thank you so much, Dr. Phoebe Luca, who is a professor in the Department of Chemistry here at the University of Louisiana at Lafayette. And so with that, Dr. Luca, it's all yours.
Well, I'd like to thank you all for being here. And I'd like to thank everyone who's just joining us online. Be great. And we will take the opportunity to ask our expertise in the field and see how can we get some information and be aware of things. And let's get started if you're ready. Ready? So what do you think, what are the recent developments in breast cancer detection and treatment have significantly improved patient outcomes? And how are these advancements being integrated into the community healthcare setting?
The one thing about breast cancer is we're always looking for opportunities to improve how we find cancer or how we treat it. And so I can break it down from the beginning. So the way I think about it is screening mammograms have been advancing. We used to have only 2 images. Now we do images with multiple images at a time that lets us kind of look at the breast tissue with better accuracy. With that, we've advanced to uses of MRIs in settings of high risk patients. So those are patients who have some kind of family history or handed down a gene from their family member that put them at increased risk. One of the most recent advances that we have is what is called contrast mammogram. And that has been definitely very beneficial to a lot of our high-risk patients, to patients who cannot undergo MRI testing because they either have claustrophobia or what have you. So there's a lot of reasons why we can't use a tool such as MRI. So contrast mammogram is a new and upcoming technology that we offer in the community. So those are things that we're doing to try to help detect cancer early and start there. The next steps that we talk through are surgical technologies and techniques. We've advanced in several different areas in surgical technology, and I'm a breast surgical oncologist, so of course that's where my love lives when it comes to breast cancer. But we recognize that reconstruction has shifted a little bit from purely implant-based and tissue-based using your belly, but also using someone's own breast tissue to reconstruct their breast, especially if they're not a candidate for the normal treatments that would be used for plastic reconstruction. Also using what we call oncoplastic, which is pretty much thinking of a plastic mind to make sure that our incisions don't leave women or men, for that matter, actually feeling scarred in a way that they can't look themselves in the mirrors, things like that. So those are some advances that we have in the surgical world. Radiation-wise, I think we have done a lot to move away from radiating the entire body or radiating places that should not be radiated. And radiation is something that is used to help treat the cells that you can't see. But we've gone from doing 6 weeks of radiation in a lot of people to 3.5, 4, and sometimes even 1 week. So that has been some advances based off of the community needs and what we need to do to treat our patients. And then of course, in the world of medicine, medical oncology, there is a lot of advancements in the types of treatments from chemotherapy to immunotherapies. And that's where the research really begins as far as how do we start to treat people based off of who they are and their biology and their tumors and their genetic makeup. So those are some interesting areas of research coming out now that we're all trying to start working on, and clinical trials, that's where it becomes important. So that's really why I say we have a lot of advancements. And what we have for the community is trying to bring those opportunities to the area. So we try to bring contrast mammogram to this area. We offer that, MRIs, of course. We offer all array of plastic reconstruction in medicine. But really the biggest advancement that we still need to push is enrollment in clinical trials. And clinical trials have historically lacked minorities or other ethnical backgrounds that help us to really truly understand the impact of the treatments that we initiate or that we try. So really, that's one big push I always try to advocate for, is if there's anything going on clinical trials wise, making people aware of it, because that's how we learn. That's how we learn what works.
So I have a question. In terms of clinical trials, are there a lot of clinical trials happening in Louisiana?
There are a lot of clinical trials happening in Louisiana, but they're not necessarily, Louisiana's spread out. So I think it's not necessarily happening right around the corner. So really, how do you partner to be able to get people access if you don't have it at home? So I think those are some of the partnerships that we work on with MD Anderson, for example, and as an optional colleague across the system, trying to make sure that you're able to get them to the initial appointment somewhere else, but take care of the rest of the issues as far as it relates to clinical trials closer to home. It's hard to travel a lot of places and be a part of clinical trials. You have to do everything 3 hours, 4 hours, 5 hours away. It's a very big impact on people's families and the household. So really what we've been working on is to build up our ability to take on the research projects that are going on across the nation, and partner with our sister entities that are neighboring and nearby to help bring clinical trials here.
Any other questions from the audience about this topic? Do you have anything to add?
Not for this particular one. I mean, really, as far as the treatment and developments, that's, you know, more of a Dr. Christie question, but.
We actually can.
Oh, you have a question?
Yeah, I actually have another question, because with research, I'm really interested also in, so patients can get involved with clinical trials, but, you know, what other kinds of ways can students get involved, graduate students, are med students involved? Where is the professional entry level?
Sure. I think that is a good, very, very good question. I would like to say that we would do better at that. That's something that we're working on. We started what we call an OASIS program, just to begin to have some better collegial conversations around how do we get people involved. What we've been starting to do is get students trained in CICI training, which is kind of what we use as our research benchmarks to understand how to conduct research, and then be able to partner with the other institutions to talk about which trials can they get involved in. And so really that's the biggest impact. The biggest impact that we have now is the residency programs in the medical schools that we start nearby, because those are where that also begins. You need people to help do those things, right? And so as we grow our surgical residency, for example, or internal medicine residencies, as we grow our medical student footprint, I think that really helps to involve our undergraduate students, because that's really how you try to intertwine that information. And you need people to spearhead those projects to make sure they see the light at the end of the tunnel, right? And so I think really the biggest thing is continue to partner. Coming here, me being here was one of the things that really ignited a fire in me to say, hey, we gotta do better for our students who don't even know what they wanna do medicine. Medicine is being a doctor, but it's also being a scientist. It's also being involved in research. It's all those things. And how do we begin to do better at partnering with that, to be better mentors for students today? So I think this is the beginning.
So we know that education is one of the main keys to everything, to knowledge. So what do you think? How does the community education influence early detection and determination adherence? And what strategies have proven effectiveness in disseminating vital information to the population?
Well, for us, we see the best outcomes when we get in front of the community, when we get in front of patients, families, neighbors in the community. Acadiana is a very large area, and at Miles Parent Cancer Services, we actually service 10 parishes in Acadiana. And just within those 10 parishes, last year alone, we had over 4,000 cancer patients and families that utilized our services in some way, just in 1 year. And since we opened our doors in 2002, we've had over 21,000 families that have come through and utilized our services in some way. So being that it is such a large area and there is so much information that's associated with resources that are available and that sort of thing, you know, we try to get out in the community to bring those resources out. A lot of rural areas, and it's not that easy for patients. Dr. Grigsby mentioned, you know, travel for patients or even just for the community in general. And so one of the ways that we have seen a benefit is by doing community outreach in a lot of different capacities. A few years ago, we created what we call our Mobile Miles unit, and it's basically, we like to say, our office on wheels. And so we're able to take, whether it's resource information or whether it's actually supplies for particular patient needs, we're able to bring those out into the rural communities in Acadiana, or just further out communities and bring those resources and information or supplies to patients and families that are in those areas. So that's been a really big implementation for us, is trying to, get out in Acadiana as a whole and spread information, because we see that firsthand. I mean, that's the best way, is really boots on the ground, whether it's from us or whether it's through individuals that are, helping us advocate those services for patients as a whole. And then we also see, as a part of that, being face-to-face with patients, which I'm sure Dr. Grisby can attest, talking to patients, seeing what their needs are. That's been very important for us. So we really want to try to put our service coordinators in front of individual patients that are out in the community, where we can see how we can best service those patients. In social media, obviously now we're a very tech-driven society. Face-to-face, being out in the community, that's number one, 100%. But with the advances that we've had in social media, of course, being able to get those resources out to a mass population, it's been so beneficial for that, where we're not having to necessarily travel all around the state, attending community events. We do that too, but we're able to supplement that information through social media as well. And that's been huge, just for, helping push, whether it's statistics on cancer diagnosis or resources that are available as a whole. That's been really big for, I think, the cancer community, but for our organization as a whole as well, just getting out, being able to get out that info.
And I would say the other part of this is how well we educate people, right? So, I think you mentioned it before, like, I try to spend as much time making sure that my patient understands what's happening to them, why it's happening, why this treatment is for them, and the importance of screening, for example. So I get a lot of, I don't have family history, but I got this. And I'm like, well, just being a woman puts you at risk. 1 in 8, you go to Target, there's 8 people in line, one of you had breast cancer sitting in this line. So it's not really a genetic. Genetics is something that we talk about a lot lately, but breast cancer is not really a genetic disease. It will be, it probably is at some point, right? There is some portions of that, but it's just because we're female, right? And you are already at risk to have one cell go wrong in your body, right? So how do I have them explain it to someone who's not in the room? Making sure that what I'm explaining is in terms that they understand. And then they are the advocate. They spread the word a lot, right? But also being in the community. So being in the community to dispel some myths, to understand the barriers, I think, is the biggest thing. I think a lot of people feel that they may or may not be able to afford taking care of themselves, right? We have a lot of people who taking a day off is a very big hit to their family or their ability to pay a light bill, right? So making sure that we are educating on resources around not just screening mammograms and detection. People know, I think people just don't know what resources they have around affording it, right? Okay, so you get a screening mammogram, you have a diagnosis, and then what? How am I going to pay for, right? So being able to make sure that people know there is financial support out there. Partnering with the state, we partner with the state to provide screening mammograms, but also provide support for diagnostic workups and treatments if you were diagnosed. Like, those are the things that we want to make sure people understand, so they're not scared of fear to go see a physician or a doctor or to evaluate something because of the cost. So those are just some things from an educational standpoint. Getting out in the community, speaking about all that is very important. And understanding the barriers is probably the biggest part.
One kind of piggybacking on that too. One other thing that's been, huge for us as an organization is really exploring those medical partnerships, partnerships with, offices like Dr. Grigsby's office or other, community-based organizations, not necessarily just those medical partnerships, but when we, are able to partner and share those resources, in turn, it just benefits the patient in the end. So that's been really important for us too, to grow those relationships, which in turn grows that community education, grows the patient education, and just makes those resources and knowledge of the resources that are available more readily available to patients.
Any questions from the audience?
I feel like I'm full of questions.
No, I love it.
But I have another one. So myths, you talked about social media, and then Dr. Grisby also talked about myths. So I know that working even with freshmen and sophomores at a college level, the number of things that I have heard over the years are amazing. So how do we begin to tackle those myths, and does the addition of social media make it worse or better?
That's a really good question. I think that it's almost twofold, you know, on one hand, it's like, you know, you can go so far down the rabbit hole on any subject on social media, right? So obviously, I'm sure there's a lot of educational information that's not accurate, that's just put out there and it goes out to thousands of people. But we're also able to counter that by, you know, reputable organizations or medical offices sharing statistics or sharing resources or, you know, as things change or as developments advance. I think we're able to counter that by using that same tool to put out the proper information.
Yeah, I mean, I think that's right. The access to information is out there. The question is the right information, right? Or the appropriate resource or source of information, right? Everybody can be an expert on social media if they talk, right, in theory. But I think the point is to say that you want them to be directed to the right place. So we try to say you're gonna find a lot of information on the internet. So when a patient gets a diagnosis before they see me, my nurse navigators will reach out to the patients before they come to see us, just to talk through what their visit is gonna be like. So try to quell some of the anxiety, because from day zero, they're probably anxious the entire time. And they're going to want to go and research and do all the things. But
Google is the worst.
Google is definitely the worst. And I always tell people, they put their horror stories on Google, you know, but they don't, majority of people have good stories, good outlets. And I also make sure that people know that everybody's journey through a cancer diagnosis is always different. It doesn't even matter how, even if they're so close, they're always different. And so what you hear from your friends or your social media or some other avenue may not be your actual journey. And so understanding that. So here's some resources that will give you information to help you begin to understand the journey. But my goal when you come to see me is I'm going to help you understand it even further. And so those are just, yeah, it's hard to think about social media in the midst of, you know, radiation. What does that do to your body? Those are the biggest things that I hear. Deodorant, you know,
Side effects.
you know, it's deodorant itself, you know, none of these things are proven in the sense, because it's hard to prove cause and effect, right? If you have so many environmental factors, right? And so there is some research in that as we talk. I think we have some questions about that, but they're trying to figure out what are those risk factors really like, but it's hard because you have so many things you're doing at once. It's hard to say if that one thing causes the problem, right? So I do get that question of, I did this, did that cause this? And you're like, no. The reason why we make you take off deodorant is because on a mammogram it leaves calcium on your skin. It looks like calcium speckles that we would want to biopsy, but it's on your skin. So that is the reason. So being able to have that conversation with somebody so then they can go tell somebody else is the important part.
If no questions from the audience, I have questions. First, I would encourage everyone to get one of these. It's very like it's really very important. Sometimes we think we won't need such thing, but this service I haven't heard of before. That it's free and they can help a lot of, like, not only breast cancer but also different kinds of cancers. So please make sure you pick one of these, because at certain point it might be helpful. Because I know that when we first hear that you might need to go to the cancer center, like when you hear this from the family doctor, sometimes it's scary. So, but we never know. When I first heard that I don't have any history in my family, so why would I go to this? So, but I have a question. Now, I'm gonna ask Ms. Hernandez first. If some people would like to volunteer to help with this, how can they impact?
Absolutely. So we actually have a volunteer coordinator on staff. So we are always looking for a variety of volunteers throughout the year, depending on time of year and what activities are going on. So some of the stuff is inner office type things. And then of course we have a few internal events that we plan every year. In previous years, annually, it actually would take us 1,200 volunteers a year to facilitate January to December in some capacity. And so It's a lot more than you think, and we rely so heavily on our volunteers. We're a very small staff. We cover a very large area. And so we're always so grateful and always looking for additional help with a variety of tasks and things like that. So the best way, if you're interested to get involved, is to either call our office, and then our receptionist can put you in touch with our volunteer coordinator, and then, you know, she can have a dialogue about what you're looking to do, whether you need service hours or not, because we do also offer service hours available for volunteering as well. So if you have a group, church, organization that you need to get hours for, we're able to offer that in turn for volunteering for us. As long as we know ahead of time, we can keep track of the hours through our volunteer platform and send a certified letter to, you know, whoever it needs to go to give you credit for those hours. So,
Thank you for the information.
thank you for asking. I appreciate
I
that.
have a question to Dr. Christie as well. I'm involved with students doing undergrad students doing research. Some of them are in pharmacy, some of them are planning to go to medical school. And we are doing some research that involves cancer. So how would the students benefit from this, or how can they contact you or have a kind of collaboration, or maybe some information about what you're doing?
I think the best way to do that is I just give everybody my email addresses and phone numbers, but because then I get you in contact with our lead research teams. We have a research coordinator for Ochsner Health, and we try to give as much training as we can around that, and then get you connected to different research projects that we do have going on. So I would say your first step could be me, and I can figure out the rest from there for sure.
Thank you. So as we all know, if you don't have any other questions, I'm gonna proceed with the information. Okay. As we all know, like, the culture in academia is unique. So I would like to ask about how do the culture and regional characteristics of academia impact the breast cancer awareness, treatment approaches, and patient support, and what the strategies are involved to meet these.
So on the patient support side, you know, Acadiana is such a community-based organization. And so for us, community events have played such a major role in helping us get the word out, either about resources that we provide or just cancer resources as a whole, patient support resources and education. And so obviously we participate in a variety of community events, but we also plan some internal events as well. And the reason that works so great for us is because, you know, we have all these members of the community that come out. And so, you know, they're enjoying this super fun event, but in turn, they're, you know, simultaneously advocating for services as well, because even if it's unbeknownst to them, by them attending one of our events, they're educating themselves in some way. Even if they don't realize, they're getting that education on cancer resources that are available. So, you know, boots on the ground that's our number one form of advocacy. So by us planning these events, it's kind of twofold in helping us put information out to the community. And then the second part of that, Acadiana is such a family-based area as well. And one of the things that's important for our services is that we were founded based on a family's personal experience with cancer. And so all the services and programs that we offer were, you know, based on a family's specific needs with cancer. And so I like to share that because this, you know, allows us to be able to directly fill in the gaps with cancer care with firsthand experience, and it kind of helps us be able to tailor services to community, you know, families in the community that are, you know, experiencing their own cancer journey, and help tailor that to the specific needs of patients in our area.
Yeah. And I would say from a physician's perspective, I think the biggest thing that I noticed is, well, what she said is that there's a lot of support. You'll find everybody rallies around people, and I find that everybody rallies around our patients. Like people are knocking at the door to bring them food, and sometimes it overwhelms them, but it's a good thing, you know. And I think that's what's really great about our culture here. I think really what we're spread out too. So we have a lot of rural areas. We have a lot of history and people who still kind of operate in space, but they don't have internet access, right? We don't have access to things, and so how do we begin to bring what we need? So that's where we start to work on mobile opportunities. Can we bring things closer to someone's home? I think partnering with our local churches and communities is the biggest impact. I think the community church leaders across Acadiana are very strong, and they are very invested in their constituents, people who are coming to them every day, and they are trying to make them healthy. They are trying to be a part of that family and keeping their family healthy, so that they are very much advocates for the community. And that's really been a very big impact, at least for our ability to get awareness out there, to talk about screening events, not just for cancer, but hypertension, diabetes, all those things that are a risk factor, stroke. And so those are the partnerships that happen across Acadiana is great. I think there's no doubt about it that people care about the community and they want to see people do well. I think really it's just trying to figure out how to do that in every way you can. Not every tool is going to work for every person. And so trying to drive that, I think the community is starting to wake up and realize, we need to figure out how to get internet places. We need to figure out how to create treatments where we can. So for example, in the cancer world, we try to bring our infusions closer to home. So we may not have a doctor on site all the time, but it doesn't mean someone can't get their infusion 15 minutes from their house, right? So you might have an appointment with your doctor every 3 months in Lafayette proper, but you may have your infusions in Jennings, right? And it's close to your home. So how can we do that part better is really what we need to work towards, and what we've been starting to work towards is bringing the parts of your treatments to closer to your home, because it is a lot. It's a lot to drive. Radiation treatments need a lot of time every single day. So when I said 6 weeks, 4 weeks, every single day for that period of time is a lot. And we've partnered to figure out how to provide transportation or hotel stays. So we have patients who weren't able to make it to their appointments because they were on transportation, kept waiting about them. That is going to be a problem. So we figure out how do we fix that. But I think if we can bring things closer to people's home, that's how we impact awareness, treatment options, and the treatment approaches. Because everybody should have access. How do we do that is the question, and that's what we got to work towards.
Well, and kind of piggybacking on that, that's something that we see too. I mean, being that, like I said, Acadiana is such a, a large area, there's patients stationed all over, and oftentimes, especially with an initial diagnosis, depending on, the type of cancer, some patients are, traveling to MD Anderson or to New Orleans 3+ times a week. And so not only the financial burden that's associated with that, but even just transportation as a whole, and if they're staying in, the areas they live in for treatment, still getting resources to them is not always that easy. I mean, even just driving from, Mamou to Lafayette or Arnaville to Lafayette, I mean, that's a nice little distance, and so one of the things that we've been able to develop over the years is one of the services that we provide is transportation assistance in the form of gas cards. Now, obviously, there's some parameters around that. So many patient has to be, traveling for appointments so many times a week, so many miles, that sort of thing. But we're able to help with transportation assistance through gas cards, and then of course, our mobile miles unit, getting those, whether it's medical supplies or nutritional supplements, those tangible services out into those communities where someone's not having to necessarily drive, to Lafayette from Arnaville or Crowley or whatever, to get the items that they need. So I know, we've really been focused on that as an organization. There's a lot of other organizations that are kind of gearing towards that, because as we see, the numbers are continuing to rise every year. So how can we best get those resources out to those areas? So we're constantly, trying to develop, new ways to do that.
Yeah. And I think that's really speaking volumes. And I think as you mentioned, patients going to MD Anderson and New Orleans, for example, partnering with them to figure out how to do a visit here virtually, and it, may not be at the patient's home, but maybe it's here in a room where they can still see and have a visit, and there's a physical exam, and there's doctor-to-doctor conversation about treatment options and plans. There's certain treatments, certain cancer types, or even in the hematology world, certain hematology issues that, have better research somewhere else that we talked about. But we want to be able to input somebody in the trial, but we only do these certain steps. So we need to get them linked, but the patient just can't travel back and forth to do it. So those are some things that we've done in the community to try to figure out how to provide care, but we may not be the experts in it today, but there's somebody around us that we can partner with that is, but the patient shouldn't feel the need to have to travel always somewhere to access it. So, yeah, thank you.
Any questions?
I have a question. So I have a cousin that just recently had a double vasectomy. She was diagnosed, I believe, a year ago. I'm wondering, how do you guys address like treatment shortages? Is that something of a
Shortage of
concern,
medicine,
or-
like medicines?
Yes.
That's a tricky one, because, I think we've seen, obviously, since COVID, there's a lot of shortages, of a lot of things. We end up we ran short on cisplatin for a while, and had to figure out how to, the toughest part of a job is to figure out who do you prioritize. All right, and that's, that's one of the jobs that, I can tell you, you never really want, but someone has to figure out how to do it. And even today, like right now, we're experiencing shortages in IV fluid, right, which is you think that you should never have a shortage in IV fluid, it's just fluid, right? But now you have to figure out how to prioritize a certain surgery or a certain case, and then during COVID, we saw it the worst. That was when we had some patients that we couldn't do your surgery, you have cancer in your body today, but we can't do it because we can't get you to the hospital, so we're gonna put you on this medicine. We learned a lot from that experience, I can tell you that, but when it's a shortage, you do the best you can. You try to make sure that you're prioritizing those you can get something else to that can hold the cancer at bay or still shrink it, right? We know we don't want it to get worse, and have a process involved and how you're gonna monitor that. And then when something becomes available again, you begin that process, and that's just kind of the best that you can do, right? It's no one wants to have that conversation, I can tell you that. But I think you try to do the best you can to make sure that your patients are gonna still be okay, and that they're not gonna have a detriment from the decision.
I have a question, kind of thinking along that line. So one of the things that we're very much involved with is trying to engage students to think about employment and entering workforce in a different fashion than perhaps they might originally think. So thinking like in high school, if you think about medicine, doctor and nurse is fantastic, but there's more. So you
Way more.
mentioned infusions. So an infusionist is, 4 years plus another 2, I think. So when you're talking about building, for instance, allied healthcare, in Louisiana, in our area, do we need more of that? Where are we at with workforce? And what can we do as educators to push that forward? What advice would you give us?
I think the biggest thing that we can do is exposure, right? I think, that's where I think we did our first run with, and I go back to the OASIS program, because that was our first attempt to really try to figure out how to expose people to not only being a physician, but a physician assistant, a nurse practitioner, a CRNA, a physical therapist, an occupational therapist, surgical tech, infusionist, physicists. Physicists are PhD'd and they do stuff with radiation. If you don't know that, that's all part of medicine track, but that's a big need that we don't have today. Like, how do we expose people to all the realms of whatever level of medicine you can be a part of? It doesn't necessarily be every part of medicine, every little bit that we do is important. Every little touch point, from the patient walking into the door to the receiving a treatment, and how to get one thing from lab in the lab being drawn, is all important to take care of a patient, right? So trying to figure out how to expose people to all those nuances is the biggest thing we need to figure out. And I think the first thing we thought of was exposure, and creating programs that bring undergraduate students to the table early to understand what their options really are. You're right, people think, oh, we're gonna be a doctor, it's tough, it's a long road, I enjoy it, I'm a surgeon, that's even longer, probably, and I did a fellowship, even longer, but I think that just to speak, it's a different personality, but not everybody needs to do that. Like, not everybody needs to be a physician. Yes, we absolutely need more physicians, because there's absolutely a shortage of us, but also look people to do something they're gonna love, right? Because that's what makes it a career, not a job. That's what makes it a calling, like, and I tell people, you're gonna have pathways that you thought you were gonna go down, and you may end up down another pathway. I thought I was gonna be a head and neck surgeon doing cleft palates and cleft lip surgeries over in Uganda, I don't know. But then I was like, breast surgery became a calling for me, because I felt like I was really making an impact on people. And that is how I ended up in breast surgery, by the way. But it's just, I feel like I'm making a big impact. I enjoy what I do, but it's best to enjoy what you do, because it's not gonna be a job. It's not gonna feel like you wake up every day and don't feel like that you are dragging in, right? I could be tired, people talking about being tired and just going and going and going. But if you are passionate about something, it's not gonna be. So if you think being a doctor is what you want to do, it may not be, but you might find that you are helpful in a different way, right? And you might find that you're helpful in the medicine space, if that's what you want to do, science. like, all those things are always important. We wouldn't be where we are today with breast cancer research or lung cancer screenings or any of those things without people doing other things that weren't necessarily important.
Well, even in the cancer realm specifically, I'm sure a lot of people grow up and they want to make an impact in cancer. Naturally, you think, I need to go be an oncologist to do that or be a doctor. But, we work with physical therapists that fit for our lymphedema sleeves. And so they work, which you probably wouldn't think of, but there's, as Dr. Grisby said, there's a lot of different facets to even just to give back and get involved in, with the cancer population and with, patients that have cancer. It looks very different. There's a lot of different career choices that are speech therapy. There's a lot of different career choices that are very, very valuable to,
Speech therapists work with our head and neck population, they get radiation to their neck and they can't swallow. Like, you don't realize how important it is. Those nuances to teach people how to swallow again, you have no idea. Females getting surgery for ovarian cancer, sometimes their muscles don't work as much, right? So you have to retrain the muscles in the body to be able to use the bathroom appropriately. There's a lot of things that people do, and that is probably the biggest thing that people can do for somebody beyond just doing surgery, and that's, to me, very important.
May I ask a question? Because I never thought of that. I think when we talk about COVID, this is something, but if there is no COVID, why do we have so shortage in, is it because, this is a question I'm just trying to just put
Wrap your head around.
question, put things together.
Yeah.
Is it because the number of cancer patients is increasing, or this is just because we have shortage?
I think it's twofold. I think we've always seen a steady influx of cancer. I don't think, I hate to say it that way, it's just not something that seems to be dissipating. I think the issue though is the people that help us make the things, right? So that I'm saying chemo is one of them, but there's a lot of parts of an IV bag, of tubing, what have you. Those are coming out of places that need workers and people to be at the job to create them, right? So if there's only one place that does it, so for example, we use something to help us find lymph nodes when we're doing surgery, and it's a substance that's pretty much only made in one place, the Netherlands. And right now, there's a shortage from the Netherlands because it requires certain material, right? So we can only get 3 days worth of it. But it's because it's only made in one place. And again, that's just what's happening today. I mean, ideally, you don't want to put all your eggs in one basket, but there's no choice, it's a destination, right? So it's also, people want to work different. I mean, I can't fix that part either, right? So people don't necessarily work all long hours, and they shouldn't. It's not what they're supposed to be doing, but I think the issue is that has changed, which has led to differences in how things get produced. And so, but that's a shortage from not just medicine, from various different things. That includes vitamins.
But it's not related to the increase of number of patients, like cancer patients. It's sometimes some other different things, which open other avenues in research. So people actually think about what we need that we can get from the United States instead of just thinking to get it from somewhere
else. I know.
And it's really not always available.
Right, so that's when they invented, it's called MagTrace now, which it's an iron particle made in the United States, and so I have to use that, which is easy for me to get for lymph node mapping, but it's not. So when they call me and tell me it's on back order or whatever they want to call it, I'm like, okay, no problem. We'll just use this, but it's just, but that's where you're talking about new things, innovative things coming out of these issues.
So, as I said, these are things that might open new avenues for people who are not like in the medicinal field, but can contribute somehow to fix such kind of problems.
Absolutely, never know.
But do you have any other questions about this topic? Any questions from the audience? I'm gonna move to access care or access to care, which is a little bit technical. Because some people would say, okay, I did my mammogram, they advised me to do another test afterwards, and they really are not aware that they must do that test. So,
Sure.
like,
Yeah.
and let me tell you, as I'm not a doctor, so sometimes they, my friend was fine, why did they ask me to another test? So, that's why I'm gonna ask this question. What initiatives are in place to make advanced breast cancer treatment and support services accessible to underserved communities, and how can these efforts be enhanced?
I think really the biggest thing is, we've partnered with the state, to provide funding, like I said before, for uninsured, underinsured, patients who need access to breast screenings, breast care, cervical cancer screening, which is the other part of this puzzle that we don't talk about too much, but we should. And cervical cancer screening. So we provide free screening mammograms, free cervical screenings. And then if they need additional workup, we provide the funding for that. If they get a cancer diagnosis, we have a track to enter them into our Medicaid coverage. They get covered for all the rest of the treatments they would need, which could be surgery, chemotherapy, medicines. And I think getting that out in the community has been our biggest goal this year. We've pushed a lot of that out to all our communities and hitting the ground running there. I feel like, but I think just bringing funding to the area somehow and awareness about the funding has been our biggest focus, I guess, and task as far as access. But then the other parts of it is actually getting there. So that's the other community partners that help us do that.
Well,
for sure.
And what, I guess the biggest takeaway is cancer is expensive.
Yes,
We
it
know
is.
that. But initially, I think when most people think of cancer, they think naturally of the medical side of things. So the diagnosis, the treatment, the doctor's appointments, but you forget about all of these other, tangible things, or just things that are gonna be a part of that journey that also are very expensive. And so, I think it's very important that we continue to increase resources that, are free of charge to families. That's kind of where we come in, at Miles Pred as far as, direct resources, and 100% of what we offer to patients is free of charge, whether it's on the services side of things or the program side of things, whether it's a medical supply or a family program or that sort of thing. But we have been super lucky with this, going back to the community aspect of things. I mean, Acadiana, we're so blessed to be in Acadiana. 100% of our funding comes directly from the community, and then it goes right back out into those 10 parishes. So it's coming in and going back out to help, the families that, we're all a part of. But I think that's been the biggest takeaway, is just having, we're one resources, and, we do a lot, but having other tangible resources that are free of charge, because I mean, everything associated with cancer is expensive. And so any way that we can, get funding and increase the resources, patient access to resources. And again, that's where the community partnerships, come back into play again. Obviously community support through funding to help grow resources. But then of course, our organization, and I'm sure, many others, we're always, looking for new ways to best support patients. But I feel like, it all kind of comes back at the end of the day to funding, and then that funding helping allow, additional resources being available.
We partner a lot, like she says, to figure out what resources. So we meet, I think, quarterly to kind of talk through what we experience as hurdles. Some physicians, some nurses, some community individuals, kind of just talking through where we have issues, right? So some of them are, I think we talked about cultural awareness, right? So we have Vietnamese speaking, but how do I communicate? And what kind of resources do I have that are in the language that they can understand? Like, those are some things we talked through recently. And then we do a lot to push patients to go towards these resources when they come to visit us and say, okay, here's what we got in the community. I think it's better to boast and boost up people who do it well than us sit here trying to figure out how to do it from the inside of the clinic. So we really, really strongly partner with the community, because we're going to take care of the community together. We do it better together than we try to do it our own separate siloed thing. It doesn't work that well.
Yeah.
So I think just trying to advocate for making sure people know what's available to them and getting them access. And that's the biggest way, I think, to begin to bridge those gaps.
Absolutely. those partnerships, I think that's number one between the medical community and then the support organization side of things. And as Dr. Grisby said, you know, we call it our CAP committee or clinical advisory committee, but we meet so many times a year, and you know, it's comprised of patient navigators, oncologists, you know, oncology nurses. It's a, you know, a plethora of different fields in the industry, and that's where we as an organization really get our information from. So whether it's a certain type of you know, colostomy supply, you know, we're supposed to use, or, you know, right now we give out, for instance, Ensure, that's the nutritional supplement that we use for patients. But, you know, who's to say down the road, there may not be some other kind of supplement that's maybe has less calories or is, you know, so that clinical advisory committee from, you know, one end of the spectrum to the other, they really are our advisors, you know, of what patients need and what the proper things that we should be offering patients. But it also, the flip side of that is that it helps increase that relationship too, and it's twofold. I mean, obviously, you know, as an organization, we don't receive any kind of, you know, kickback for
Right.
patients coming to our door, but it's important for us to have them know that those resources are available. So by building those, you know, relationship, it just benefits everyone because it's showing patients that there are resources, you know, available that they're able to receive help with.
I think for this to happen, like you are working together, I think it's more like a triangle.
Okay,
The
sure.
research
Yeah.
would be like academic research, like here within the university or other universities will make this
Yeah, that's our next
very
thing.
well, yeah, so be very well.
Yeah.
We talked a little bit
together
about that earlier, you know, that's
to
kind of the,
puzzle.
I guess, the missing piece, you know, in this
Yes.
area is obviously exposure and having that available. And I know there's a lot of different groups, like both of us included, are, you know, working on that to increase research opportunities and just different types of research-based partnerships in the area. So it'll probably take a while to fully get there in Acadiana, but that's, you know, a common goal that we're slowly, you know, striving to get towards.
But this is actually a very good opportunity for us to know that, like, we can be the third line in this kind of
100%,
they can help with that.
absolutely.
And my last question is gonna be about emotional and psychological problems,
Mhm.
because from my experience, when my friend had breast cancer, her problem was more emotional and psychologically than
Mhm.
physical problem.
Sure, absolutely.
So what do you think?
I think that that's probably the number one hidden, you know, item that doesn't get talked about enough with a cancer diagnosis. Because again, you think of, you know, the treatment side of things, the physical side of things, the side effects, but you forget not only what effect it has on a patient, you know, emotionally, but also the family. I mean, cancer doesn't just affect the individual patient, it affects the whole family. So that emotional, you know, and mental support is a huge step in the overall journey. You know, some of the services that we provide that are kind of along those lines, you know, we have monthly support groups that we offer for different types of cancer. So whether it's a breast cancer support group, a prostate cancer support group, we've also had a caregiver support group. So making that connection, you know, with different individuals that are going through the same thing. Individual and family counseling, that's a huge thing. So we refer to the Center of Loss and Transition, but to be able to provide that resource for counseling. Again, we talked about the financial aspect. I mean, that's something you probably don't think of, but it's expensive to go see, you know, a counselor or a family therapist. And so we can help also offset the cost for that as well. Also, monthly family programs. So one of the things that we offer is called our Smiles for Miles program. So it's a once a month activity where we take families out for basically a night of fun. So whether it's mom or dad that has cancer or brother, sister, and the activities are all different. So it's everything from a UL basketball game to the cart ranch, or just something where you know, families can just be families and not have to worry about you know, the financial burden of, you know, taking husband and wife and 3 kids to the movies or that sort of thing, you know, but it gives parents a chance to be around other parents, to have those emotional conversations and just have a sense of release. But then also it gives, you know, children a chance to be kids, whether they're, dealing with mom or dad, going through their cancer journey, or whether it's maybe themselves or a brother or sister that has it. But having those outlets is, I think, the most important thing. Even whether you're talking to your medical provider, just having someone that you're able, to be able to have that emotional, outlet and have those support services. That's definitely something that I think gets probably overlooked the most in the whole, realm of resources and treatment and that sort of thing.
I asked that question because in academia, we also have psychology.
Yeah.
Oh, yeah.
So it's not,
100%.
when we talk about cancer, it's not gonna be only about science.
Correct.
It's not gonna be science majors or just medical field. Can be other fields.
Right, and that's one of
That
those
we
things
have
you
to
don't
get
think
everyone
about as a
ready.
resource, it's not the first on the list that you think about when you think of resources that are available, or not that it's necessarily a side effect, but you don't think of the mental aspect of a cancer diagnosis, and especially with the whole family, I mean, it really takes a toll on the whole family, so having those resources is very important.
Oh, I would like to thank you so much. This was like a lot of information.
Absolutely.
And very helpful
Glad to.
information, and we are looking forward for some collaboration
Oh,
between
yeah.
the medical field and the university, especially on the undergraduate levels, because everyone thinks they can be a doctor,
Oh, yeah.
but they can help in other ways. Like
100%.
And now just something heard about the gap year, I'm like, what is this gap year thing? It's fine.
Yeah.
But thank you so much
course.
for taking the time to come and give us all.
Absolutely glad to be here. I mean, that's the only way that we can increase education, awareness, and support is through, talking with the community. So thank y'all for the opportunity to be here as well.
Thank you.
Did you have a question?
I just got one question.
Oh, yeah.
So when I turned 40,
Mhm.
in July, I turned 40, it was a big push for like, getting screening and
Yes.
mammograms and things like that. But what about like, our students, undergrads and things like that? Is it just as important for them? Or is it like, once you turn 40, it's more important?
I think 40 is a big one for breast, but there are other cancers that people need to be aware of. I think the biggest thing though in the younger population is being aware of your family history, which has been hard and previously. I think a lot more awareness around the importance of it now, as far as what you know about your family history, because that is what usually dictates when you should start doing other things, colonoscopies, and stuff like that. But if you have a regular, I should say not regular, but average family history or average risk for breast cancer, meaning you don't really have a family member or there's no other genetic things that you're aware of, then 40s are kind of normal standard age for screening mammograms, right? And then I think they just lower the age range for colonoscopies and because we've seen colonoscopy increase in younger populations. But in your 20s, it's just more of an awareness around your physical body, your physical self, and then your family awareness and your familial history. It's going to impact what I would tell somebody to do if they're 25, right? So,
No, but pap smears, they should be getting.
oh yeah, well, yes, sorry, yes, pap
Oh,
smear,
if
yes.
you just,
Cervical cancer, yes, okay, yes, pap smears absolutely should be started with 25 or 20, with 20.
20.
But as Dr. Crispy said too, that family history plays a huge role, and we advocate for that a lot. Having that dialogue with your family, and we recommend having those questions written down ahead of time. And sometimes it's awkward, right?
Yeah.
Like, who wants to go talk to dad and see what the family history is? But it's very important to answer that. Who in your family has had cancer? What type of cancer did they have? How old were they when they were diagnosed? But writing those questions out and then go have a dialogue with mom or dad, and that's really will be instrumental, because you might find out some things that you're shocked to know, and then you can in turn take that information to your provider, whether it's whether you're going to get a mammogram or if it kind of activates the next step by knowing those things. That helps with early detection too. You might find out some things that you didn't know, which would make you go get a mammogram earlier, or go see your dermatologist for your skin or whatever it may be. So
I think the biggest thing in the youngest population too is vaccinations, and what it is. So HPV vaccine is going to be the biggest thing that helps you with cervical screening. It's also a risk factor for throat cancer, right? So it's a big deal. And so I think just being aware of those things in the undergraduate space is probably more important of what they can do to protect themselves from the risk factors that will put them at risk for developing cancer, and those are things that you can actually impact.
Yeah.
Right, because screening mammogram is screening, we're not gonna prevent you from developing a cancer, we're just trying to find it early, right? But you have things out there that actually can help prevent you from getting a cancer,
So
so.
we will make sure we will have our undergraduate students next time.
Yes.
They have
Yeah.
tested like
Yes.
exams tomorrow.
Yeah.
Make sure they get
Yeah.
the.
But I think awareness around that is probably important.
But thank you so much.
Yes,
and
thank you.
Thank
we'd
y'all.
like to thank you.
Yes.
Thank you.
I also do want you to know that one of the things that we will do for the advanced program is we will take this recording and put it on our YouTube channel so that then we can share it out to people so that they can hear what you have to say. Because I was saying, I've just thought of like 3 or 4 research
I
projects
know, I know.
that
yeah.
students could do just right here, just based on the things that you're talking about. So like Dr. Lee, thank you so much. Okay.
Absolutely. Thank you for the
Thank y'all for
opportunity.
having me.
Yeah, absolutely. Thank y'all. Thank you.
Nice to meet you. This was great.
And